p.ed1 Week 10 Introduction. In this topic, we can learn the prenatal development of a child in mother's womb and what are the effects of surrounding that can cause the baby at risk. A woman who with a child is need to have a knowledge how to handle the baby and how to take care to have a safety delivery and have healthy child. There are stages of prenatal development. The number one stage is the germinal period. 2-week period after the conception. Conception occurs when a sperm cell combines with an egg cell to form a zygote. About 36 hours after conception, the zygote begins to divide. 6 to 7 days after conception, the ball starts to become embedded in the whole uterus and it is called implantation. The second one is the embryonic period. This stage runs from 5th through the 10th week of pregnancy. There are numerous changes that occurs during this stage. By the end of the embryonic at week 10 of pregnancy, the baby will be about 1 inch long. 3 layers of the cell. Endoderm. The innermost of the primary germ layer of an embryo, that is the of epithelium of the digestive tract and its derivatives and of the lower respiratory tract. The second one is the ectoderm, the outermost layer that gives rise to skin part and sensory receptors. The last is the mesoderm, middle layer of the three germ layer that arises during gastrulation. 3. Life support system. Placenta. It is an organ that develops in the uterus during pregnancy. It provides oxygen and nutrients to the baby. Umbilical cord. Connect the baby to the mother's placenta. Number 3, the amnion. Transparent sac-filled colorless fluid as a protective cushion during embryonic development. The third stage of prenatal development, fetal period, extends from the beginning of 9th week after the fertilization to about 38 weeks after the fertilization, which is the average time of birth. Lasts a total of approximately 30 weeks. Teratogen. Teratogen are the agents from the environment that can cause harm to developing fetus. Let's go to the hazards to prenatal development. Number 1 is the prescription and non-prescription drugs. Prescription drugs like thalidomide and antibiotics can be harmful on developing fetus. Non-prescription drugs like coffee, paracetamol, diet pills, drugs that the mother would carefully take because it can harm the baby. Number 2, the psychoactive drug. Pregnant women should be careful to the caffeinated drinks like coffee or sodas. Also, drinks with alcohol contents can be bad for pregnant. Fetal alcohol syndrome or FAS is a condition in a child that results from alcohol exposure during the mother's pregnancy. Fetal alcohol syndrome causes brain damage and growth problems. Number 3, the environmental hazards. Hazardous chemicals have been found in cord blood, placenta, meconium, and breast milk samples. These chemicals includes commonly known hazards such as tobacco smoke, as well as the pesticides and product containing chlorine and other chemicals referred to as persistent organic pollutants. The fetus is particularly vulnerable to environmental chemicals that can disrupt the development process of critical times during gestation. Another one is the maternal factor. Malnutrition can cause deficiency affecting their growth and development of a major way. Lack of folic acid lead to birth defect and spinal cord. Anxiety and stress also can be maternal factors. Another one is the paternal factor. Paternal risk factors of age is significantly associated with adverse birth outcomes. A father's metabolic status may also have some impact of the metabolic trajectory of his offspring. Human life begins at conception. From the conception of the mother until the baby is born. It is not easy to a mother to be with a child, but the mother is the best guidance for the children after being born. Give love, protection, and show the world how beautiful it is and what is the role of being a human. p.ed1 Week 11, Physical Development of Infants and Toddlers. Cephalocodal and proximodistal pattern. The cephalocodal trend is the prenatal growth from conception to 5 months when the head grows more than the body. It is also the trend of infants learning to use their upper limbs before their lower limbs. The proximodistal trend is the tendency for more general function of limbs to develop before more specific fine motor skill. Height and weight. Newborn babies normally drop 5 to 10% of their weight due to adjustments to neonatal feeding. Breastfeed baby is much heavier than bottle-fed babies. Babies increase about 30% in first 5 months. Babies weight triple in the first year but slow down to the second year. Let's go to the brain development. Human brain development starts soon after conception and continues into early adulthood. Myelination is the process by which brain oligodendrocytes produce layers of myelin that wrap around the neuronal axons and act as a layer of insulation for transmission of electric action potential down to the neuronal axons. Motor development. Motor development falls into two categories, the fine and gross motor. Reflexes. Reflexes serves as survival mechanism. They have opportunity to learn. The number one reflex, such as sucking reflex, it is considered an appropriate feeding response in newborn. Rotting reflex. This reflex starts when the corner of the baby's mouth is stroked or touched. Gripping reflex. Stroking the palm of the baby's hand causes the baby to close their fingers in grasp. Curling reflex. When baby's foot stroke, the infant responds by curling his or her toes. Startle reflex usually occurs when the baby is startled by loud sounds, suddenly movement, or intense light. Gallant reflex. While stroking at baby's back to one side, the spine and the trunk will arc toward the side. Tonic reflex occurs where the side of the infant's spine is stroked or tapped while the infant lies on the stomach. Gross motor skill is the excitement part of the parents by the time they reach 2 years of age. Almost all children are able to stand up, walk, and run. Fine motor skill is the coordination of small muscles in movement with the eyes, hands, and fingers. Fine motor skills aid is the growth of intelligence and development continuously throughout the. Can newborn see? Their eyes are sensitive to bright light. By 6 months of age, the vision becomes better, and in 1 year, the infant's vision is approximate that of a child. The experiment was found out that the infants preferred to look at patterns such as faces and concentric circles rather than at color and brightness. The mother's face, the first few things that the infants recognize. Can newborn hear? The newborn has been hearing sounds since way back in the womb. Can newborn feel pain? Yes, babies do indeed feel pain, and that process it similarly to adults. For a newborn baby, skin to skin contact is a vital part of bonding And communication, they are also able to respond to touch with their gasping reflex. Can newborn distinguish different tastes? And the study that conducted, babies only 2 hours old made different facial expressions when they tasted sweet, sour, or bitter. A summary of what infants and toddlers can do physically. Standard 1, the child demonstrate adequate growth, weight, height, and head circumstances. Standard 2 is the child has adequate sensory system to participate daily activities. 0 to 6 months, start to startle to loud sounds, visually follow moving objects from side to side. 7 to 12, react the pleasure when they smell something nice. Reacts by making face when smell something foul. Standard 3, the stamina. Can pushes and pull heavy object like chairs. 13 to 18 months, plays without tiring easily, participates activity outdoor and play and exercise. 19 to 24 months, can do physical activities like dancing and outdoor games. Motor skills development from 0 to 6 months can hold head, move arms and legs, roll overs from 7 to 12 months, sit without support, stands from sitting position, walks with one hand held. 13 to 18 months, feeds self with assistance, no longer drinks from feeding bottle, drinks from cup unassisted. 19 to 24 months, remove loose sando, goes to designated place to urine but sometimes wet in his or her pants. They can remove sacks. p.ed1, week 12, cognitive development of the infants and toddlers. Sensory motor development. It is marked by the child discovering the difference between themselves and their environment. At that point, they will use their senses to learn things about both themselves and their environment. Child not child not learn only in physical but also in how to interact with others. Object permanence. This concept was discovered by the child psychologist Jean Piaget, and it is an important milestone in baby's brain development. Object permanence involves understanding that the items and people still exist, even when they cannot see or hear them. Language development. 3 to 12 months, babies communicate using sounds and gestures. In the first year of life, babies go from babbling to play with sounds, copying sounds, and putting sounds together. At this age, though this speech doesn't mean anything but they're like talking and making conversations. 12 to 18 months, your child will start using words to talk to you like dada, refer to the father. Your child might also enjoying saying the same word over and over. Point to things when asked, like familiar people and objects like books. Gesture or point after read or sounds to show what they want. 18 months to 2 years, you'll notice that your child use new words nearly every day. At 2 years old, the child will start putting two words together. Child can understand what their parents says. Language expressive language. From 0 to 6 months, expressive language is show when your baby cries to express what they want or what they need. 7 to 12 months. At this time, your baby's first words, probably not spoken very clearly, have appeared mama or bye bye or no. 13 to 18 months, you should see and increase in his or her ability to imitate gesture, words, and animal sounds. 19 to 24 months, uses pronouns, uses possessive pronouns, pre-reading and pre-matching. Child can be able to match and identify colors and shapes. From 7 to 12 months, they can able to match identical objects. 19 to 24 months, they can matches identical objects and pictures. Higher mental order activities are concept acquisition, systematic decision making, evaluate thinking, brainstorming, include the activity and rule usage. From 0 to 6 months, they can looks in the direction of fallen objects. 7 to 12 months, looks partially hidden objects. 13 to 18 months, hand over the objects when asked. 19 to 24 months, can tell which item is shorter, which item can long, or can tell which longer item that can be longer or shorter. Can use the same toys or object in more than one way. Infants' emotional life is centered on the attachment they form to their mothers or other primary caregivers. And through this interaction, infants learn to love, trust, and depend on the other human beings.